This question deals with a 55-year-old male who recently moved to your community, comes to your office for a routine checkup. Okay. Upon review of his medical records, you find that he has multiple medical problems. He has smoked 1 pack of cigarettes daily for the last 20 years and consumes 2 to 3 bottles of beer every day. So this patient is a chronic smoker, chronic alcoholic. Now let's look at the physical findings. Physical exam findings are shown on the slide below. Which of the following diseases should be considered as a cause of this patient's findings? Okay, and we have A to F choices. So what exactly do we see on physical exam? We see that the patient has finger clubbing, right? We see clubbing. And what kind of situation give rise to clubbing? I think that's the direction of the question it's going at. Now, why do we have clubbing? Let's talk about the pathophysiology of clubbing. Clubbing happens because of hypoxia. Anything that causes hypoxia. So we're going to be discussing clubbing here. Okay, so hypoxia is the main cause. Fingers have a drumstick-like appearance, right? And it's due to the fact that the phalanges becomes thickened. Thickened phalanges give it a drumstick-like appearance. There is going to be flattening of the nail folds. Nail folds is going to be flattened. See, these are flattened. Shininess of the nail is going to be increased. It's going to be shiny. And if you press on the nail, it's going to have a very spongy texture. It's going to be softer and spongier because it's always growing. Why? Because this digital clubbing causes vasodilation of capillaries in the distal phalangeal region. There's going to be vasodilation so that more blood can come to compensate for the hypoxia, to compensate for the lack of oxygen. It's going to force to come more by having more vascularization under the nail bed. Now, vascularization is not the only cause why there is going to be clubbing. Clubbing also happens because of interstitial edema. There is going to be increased growth of fibrovascular tissue. There's going to be vasodilators. A number of vasodilators is going to be present at the site of clubbing. Anyways, the point is, clubbing is caused due to hypoxia. Now let's see which of the following options here matches our story. Choice A, rheumatoid arthritis, has nothing to do with hypoxia. So that option is automatically ruled out. Next, we have bronchial asthma. Bronchial asthma, strange as it sounds, is not associated with hypoxia and is not associated with clubbing. Then we have bronchiectasis. Now, here is a disease where there is going to be hypoxia, and bronchiectasis is also relevant in this case because this patient is a chronic smoker. There is going to be necrotizing lung parenchyma. So bronchiectasis, hypoxia due to bronchiectasis is a possible option in this particular scenario. Mitral valve prolapse has nothing to do with hypoxia. I'll rule that out. Choice E is iron deficiency anemia. Iron deficiency anemia causes not clubbing. It causes another nail problem. What is a nail pathology that we see? We see spoon nails, right? Now, last but not the least, choice F, we see patent foraminovaly. Now, patent foraminovaly is responsible for shunting problems, maybe hypertrophy of the heart, of the ventricles, but it has nothing to do with hypoxia. It really doesn't cause hypoxia. So even though you might think that could be a possible option, but that's not, because it doesn't cause hypoxia. Plus, this patient is a smoker, so bronchiectasis makes more sense here. So in this case, the answer is bronchiectasis. Okay, so I want to take this opportunity to talk a little bit more about clubbing and where do we really see clubbing. We see digital clubbing in lung disease, heart disease, and there's other types of diseases that we see. In case of lung diseases, we are going to see clubbing in lung cancer. We're going to see it in TB. We're going to see it in cystic fibrosis. Okay? We're going to see in bronchiectasis, pulmonary hypertension, and empyema. These are the diseases in the lungs where we are going to see clubbing. Just if you were not sure which diseases is really going to cause clubbing. So is lung the only organ system which can cause clubbing? Absolutely not. Even heart diseases can cause clubbing as well. So any of the congenital cyanotic diseases with the 5 T's, those are the ones which are also going to cause clubbing. Okay, and then there's the miscellaneous diseases which causes clubbing. For example, the inflammatory diseases such as Crohn's, ulcerative colitis, you know, hyperthyroidism, and malabsorption. Okay, so this is the thing. I really don't know why these inflammatory diseases shows clubbing. Crohn's, ulcerative colitis, hyperthyroidism, and malabsorption. If you know the answer, please leave me a message. Please leave me a comment below saying if you know why those causes clubbing. But they do. You just have to remember Crohn's, ulcerative colitis, hyperthyroidism, and malabsorption. Anything that has a potential of little bit of inflammation is going to cause clubbing as well. Okay, so that is my take on clubbing. But in this case, clubbing was caused due to bronchiectasis because this patient was a chronic smoker.